Good evening. Welcome to episode 5 of our dry eye educational series. I'm so happy you're here joining us, and we're just really excited for this episode. Again, we're going to be doing a similar format, the same format that we did in episode 4. Hopefully many of you have had the opportunity to watch that. We have been on this journey now. We're going into our 5th month, and the reception has been phenomenal. We've got a beautiful audience out there again, and the intention is all about sharing information about dry eye, the advancements in dry eye, and most importantly, at the end of the day, the things that you can do as an individual to help improve the quality of your life every day. And these are things that will be with you, with your doctor, working with your doctor, and things that you can do independently at home with your lifestyle and your diet and your therapies. And so tonight we're going to be joined with 2 of our dry eye expert panelists are coming back for this episode. Dr. Crystal Brimer from Wilmington, North Carolina, and she's the founder of the Dry Eye Institute. And also Dr. Laura Perriman is going to be in the second half of this, and she's going to be joining us. Dr. Perriman, of course, is dry eye master ophthalmologist up in the Seattle area. And so the first half of this show, we're going to be spending with Dr. Brimer and her patient, Meredith. We're going to introduce them quickly here in a minute. And then the following 15 minutes after that, the second 15 minutes will be with Dr. Perriman and her patient, Andrew. And Andrew and Meredith are going to be sharing what their life has been like with dry eye. Before we get started, just a couple little footnotes. If you haven't participated in these before, we do have a open chat where you can, throughout the whole evening of the next hour, you can be able to ask questions and ask whatever you want. The second half of this whole episode is dedicated to getting to those questions. These questions can be questions that you can direct towards an individual doctor, to Dr. Perriman or Dr. Brimer, or to the patients, anything that comes up. In addition, to ensure that you're getting the most out of this tonight, we're going to be doing pop-up polls. We're going to be doing a series of pop-up polls. And those will be, if you're on a desktop, you will see a little thing at the bottom of your screen where it says polls, and then a little poll pops up, and it's just as simple. You can only pick one of the different, there'll be a question and then a series of answers that you can choose from, and you just pick one. And if you're on a mobile device, it's on the bottom of your screen, a little bit different on the bottom. You'll see the little bars. So please participate. It makes it a lot of fun, and it's engaging, and it also helps us to make sure that we're addressing the questions and things that are most important to you. So with that, we're going to be getting started, and I'm so excited to bring back Dr. Crystal Brimer and her wonderful patient, Meredith. Meredith is also from North Carolina, from the Wilmington area. And with that, I'm going to get started. Meredith, welcome. Dr. Brimer, welcome back. And I know that you have a lot to share. So why don't you just kick it off here and share a little bit about your experience in discovering your dry eye and what that has meant, and pearls, things that you want to share with the audience.
All right. Well, thank you for having me tonight. I appreciate it. So my symptoms, I really started paying attention to my symptoms about 8 to 10 years ago. I was starting to get some really gritty, dry, red feeling in my eyes. They were watery, they were puffy, they were sealed shut in the mornings when I would wake up. I always felt like there's something in my eye. And I was actually ended up being diagnosed with pink eye 4 times because my doctors didn't understand that it was dry eye. So they were that red and that puffy. The only thing that really seemed to help at the time was steroid drops. And none of the doctors that I went to really wanted to keep me on steroid drops. And I was going from doctor to doctor to doctor in my area. And I found Dr. Brimer in 2017. I did a Google search for dry eye doctors in my area, and she popped up. And she has been a complete lifesaver for me for the last 4 years.
Meredith, may I ask a quick question? And just because do you mind if I ask what age you were diagnosed with dry eye?
So I believe I was 31 at the time that I was diagnosed.
That's really interesting, and that goes back to show the range of just how dry eye affects everybody, really, right? Adults. And what our first pop-up question, I'm just going to do this really quick, the poll. If you will, out there, the audience, you're going to see this, and you're going to have about 10 minutes to answer this. And what we would love to do is ask you, at what age, audience, were you diagnosed with dry eye? And then we'll come back to that. So Meredith, thank you for sharing that, and please continue.
Yeah. Well, on that, I remember at my first appointment with Dr. Brimer, she told me that I had the eyes of a 60-year-old person, and I cried. I cried a lot in her office, and I didn't know how to digest and take that news. I was so shocked that my eyes were that bad. And my diagnoses, I had allergic conjunctivitis, rosacea conjunctivitis, and blepharitis. And I also was not shutting my eyelids fully. So all of those things combined, my eyes were just in really, really rough shape. And over the last 4 years, it has really been a journey of different treatments that we tried out. I remember taking a picture of everything that she sent home with me on that first day. It took up my entire counter in my kitchen. And I was so overwhelmed, but it's a journey. It's not a sprint to get a solution for your dry eyes. And I tried a lot of different treatments, and I think also finding my underlying issues too really helped a lot. I had an allergy test. Turns out I'm allergic to pretty much everything. So food, environmental, makeup, I'm allergic to fragrances, pretty much everything. And then I was also recently, within the last year, I was diagnosed with rheumatoid arthritis, and my Sjogren's markers were also positive. So that underlying inflammatory issue, I'm sure, has also been a big player in my dry eye, as well as the allergies. So
Dr. Brimer, can I ask you a quick question? In your practice, do you have a lot of people that present like that, come into the practice with allergy related issues, like with inflammation, allergies? Do you find that a lot?
I do, and I'm specifically looking for it. I think a lot of times the allergies go untreated because there's other symptoms that resemble dry eye, and we're not necessarily really picking it apart. So I'm very adamant about treating the allergies when they're there, because if we don't, it creates such tear film debris that it just is a toxicity element to the ocular surface. So I want to get rid of the debris. I want to get rid of any itching and just clean up the tears.
Interesting. And what kind of screening do you do for that with the allergy testing?
It's not a screening on allergies as much as it is my diagnostic findings. So several things. When I put my dyes in, there's certain patterns that will show up that are specific for allergies. I look down inside the lid, and if there's a lot of bumps down there, papillae, that's allergy. If I see stringy mucus in the tear film, that's allergy. And of course, if they're itching and it's in the corner next to their nose, that's allergy. So anytime somebody's itching, I always say, is it in the corner next to your nose? Because that's normally allergy, whereas if they're itching along the lash line, it could be more bacterial. And if they're just rubbing their whole eye, then they just might be dry and looking for some sort of relief.
Thank you so much. And Meredith, boy, like you must have been, that's quite a tailspin, right? When you're sitting there and hearing all of this.
Yes.
How did you approach that? What was your first step towards?
Well, I tried everything. We had allergy drops, fish oil. I'm trying to remember. I think I was on Zydra for a while. I was on pretty much, I had masks. I had which I could not keep on in my sleep. Kept taking them off. We did punctal plugs. I believe I had LipiFlow once, And we finally, I think we've set on a really good regimen now of allergy drops and IPL every 6 months. That has helped a lot with the rosacea, and so I'm starting allergy therapy, slit therapy for my allergies. And I have a Lotamax gel too for flare-ups, for whenever my eyes get really bad, then the Lotamax gel helps a lot. So it's, yeah, if you can name it, I've probably tried it. And,
wow, how are you feeling today?
today is pretty good. So I'm doing all right today.
And you feel like you've been making a lot of progress through this, like it was worth this?
I am so much better than where I was at, and it's still a journey. I mean, Dr. Brimer can attest, I'm not the best with compliance. So I'm trying to learn good habits and starting to create patterns for myself to follow so that I can get to the point where I am in a good routine and with all of my treatments. So
that's wonderful.
And just to kind of add in, Meredith, and maybe this is specific to you, but it's really more of a general statement of patterns that I see in folks. Yeah, there was a lot of things, but it wasn't so much, it wasn't like a trial and error. It was us looking at what's the problem and let's put this with it. And then seeing, is that enough? And if it's not, then we add to it and we do things differently. But to hear and kind of reminisce of all your symptoms, because we were in the exam room together, and just, it's so different now, you know, and I see this in so many people where that's not the person I remember, because the person I see now, I'm like, how are you doing? I'm doing great, you know, and all the days are pretty consistent, and it's really all about stabilization. And yeah, it's a lot of work in the beginning, but as long as we really look at the underlying problems, we pair it with treatment specific to it, then we get there, we get to that stabilization point, and happily, you know, you can look back and say that was a different person than you feel and you are now, because back then, you know, most of these folks, that's their life, is they're completely distracted from all the things they want to enjoy because they're thinking about their eyes all the time. Mm-hmm. And that's our goal, is to get them to where it is, yeah, there's some to-dos in the morning and at night, but you get the rest of the day to yourself. And that's a big advancement compared to where we were.
That's really
so, and the other thing I'll say is this is not uncommon to have these late diagnosis where we're looking and we're saying, all right, there's something inflammatory here. This person is very young, but yet has the appearance of the inflammation of somebody older. What is driving it inside their body? And diving into that, and especially with Sjogren's, people can test positive for, I think they said the average was like 6 years before they finally they test negative for all this time before they finally test positive. But being able to identify it as inflammation and try to treat that specifically, even when we don't have a firm diagnosis of why it's there.
Yeah, thank you, Dr. Brimer. And I know I know that when I started this company 18 years ago, I did it because of Sjogren's patients, and we've come so far in being able to diagnose that early. And so that's really a positive thing that you were diagnosed early, and there's all kinds of things that are out there now to help manage the symptoms, mm-hmm. in addition to the other things that you've presented. I have the answers for the pop-up poll. So we have, interestingly, we've got 19% of the audience were diagnosed under the age of 24. Wow. 7.7 between 25, 34, 7.7, 35 to 44, and 65 over 45 years of age. So what about, that's interesting. So we do have a good, almost 20% of the audience that are paying attention, which is really great, because that, I think, is where we're seeing the trends in the industry, is that this is an opportunity for everybody really to embrace their ocular surface health and be able to take advantage of the science that we have today and the tools that are available to really prevent a premature development of a dry eye condition prematurely. So with that, I'm going to, so this is how fast it goes. We're already at 5:16. So those were the results of the first poll. I'm going to bring in in just a minute, Dr. Perriman and Andrew, introduce you to Andrew, but I am going to also just give you the second poll, audience, for what we're interested in hearing tonight. And this one you'll again have about 10-15 minutes to answer. And the second poll is, do you have a gluten intolerance? And that might be of, so that's obviously a great interest to our topic of conversation tonight. And with that, I'm going to have Dr. Brimer and Meredith are going to come back in 15 minutes and join us with the whole panel for a Q&A session. And so thank you for sharing, Meredith, your story. And I know there'll be more active interaction here. And I'm going to bring in Dr. Perriman. Welcome, Dr. Perriman and Andrew to the show.
How's it going?
They're up there in beautiful Seattle, Washington, where we see snow in the background. But welcome back, Dr. Perriman, and welcome, Andrew. And so,
Awesome
Andrew,
to be here.
I'm sure that there were some things with Meredith's story that resonated, but I know you have a lot to share with the audience alone. Do you mind sharing what your experience has been relative to your ocular surface health?
Yeah, so so a little disclaimer, it's really cold in my house right now and I'm a nervous speaker, but I'll do the best I can. So thank you. So where do I start? I would say, to put it bluntly, I was definitely a sick kid. I probably had IBS all throughout high school, middle school, into my college years. I'm 25 now. And I would say that acknowledging that there was some sort of systemic component and that it related to the other health problems I was having is probably the largest parallel that I can draw, and made the most progress in kind of pushing forward and finding a treatment plan that worked. And also finding a doc that shares that progressive view in medicine, that it's not so myopic and that it's just focusing on one facet of your being, and acknowledging that there are other confounding factors that contribute to this.
That's great, Andrew. And you want to share some of the things that occurred, like what happened, how you met Dr. Perriman?
Yeah, absolutely. So it initially started when my girlfriend and I took a trip that we had been planning to go visit some countries, and I noticed that I was getting these styes in my eye, which I think I had just thought was normal until I ended up getting like 4 or 5 of them. This cannot be a normal thing. I hadn't had dry eye symptoms at that point, but I definitely was abusing contact lenses as well. So I would always get dry eyes and they would get irritated when I'd wear my contacts for too long. But so fast forward past that trip, I realized that these inflammatory nodules that were forming on the tarsal plate within my posterior lid margin, there was something going on. It was maybe a disease or, something I was eating. I don't know. But I ended up going to a doctor and going to another doctor and then going to another doctor who all prescribed antibiotics, which worsened my health overall, I feel like, just because I ended up getting gastrointestinal reflux disease, and that spiraled into autoimmune hepatitis I had an episode of. So it was all these really terrible things were just happening in this like 2-year period. I should probably say that this is about 2 years ago that this all started. And finally, I got a celiac disease diagnosis. So there's that inflammatory component that pops in that's more systemic. And then finally, I found Dr. Perriman, a doctor that acknowledges that, there's some of these outside factors contributing to the eye disease. And she is anything but myopic, because she took a real just approach from all directions. We're going to, treat your allergy here. We're going to treat the inflammatory component here. and we're going to try to, cut down some of this blood vessel proliferation, which is telangiectasia. It's a tongue twister that probably a lot of people with ocular rosacea or blepharitis have some familiarity with. But yeah, it's my eyes were so dry I could not keep them open for a second, and I would have to blink. And you can see I kind of look crazy right now because I'm not blinking at all, So it's quite the turnaround.
Thank you. Yeah, Dr. Perriman, quick question. So a lot of this too, I would imagine, because you've been practicing for how many years in dry eye? Decades.
Oh, I'm gonna date myself. Let's see, since 2008. So what is that?
It's
13 years.
2008. So in your what you're seeing today, isn't it just amazing the things that you're able to diagnose today when a patient walks in with multiple things going on? So is that something that is new, your process, and how when somebody comes and presents with all these different things, what your ability is today versus even 5 years ago to not just properly diagnose, but to treat? Is that a fair statement?
You're 100% correct. Like back when I started, we had staining strips and we had one immunomodulator and we had punctal plugs and some steroid, and that's all we had. And now I feel like our understanding of dry eye is so much better than it was, and we have wonderful tools to address every facet of this multifactorial disease. But the good news is that we're all still learning. We're all still learning these new tricks of how to really deep dive into each individual patient's composite picture and then customize and tailor their treatment protocol based on the big picture, on all of it. And all these little pieces work together. If you have enough inches, you eventually get to a mile. And just being able to really deeply observe these patients, not only initially, but over time, and continue to learning. Like I read all the time. I'm such a dork. I don't read about hardly anything other than dry eye science. But that's okay because I love it. It's so interesting. And like everybody here, I also suffer from dry eye. So I get it. I know how tough it can be to continue living your life and how disruptive it can be. And it gives me and my team immense heart glow happiness to help these people get turned around.
That's awesome. And Andrew, so when you started understanding where you were in this, right? And what can you share with the audience some of the things that you did to change, like to help? What was kind of your first step towards embracing the opportunity to take control of it and make some changes in your lifestyle or whatever you were doing? What were some of your first steps in treatments?
So I think the biggest first step that I took was sort of the remembering and realizing that human beings in the modern world are living sort of unnaturally in terms of, what our ancestors, what sort of lifestyle factors they participated in. So I was kind of searching for, a more natural life. So the first thing I did was I altered my diet. Obviously with the celiac diagnosis, I was happy to cut out wheat, but I also cut out grains just overall initially, and I ended up doing the autoimmune protocol. And believe it or not, my dry eyes, from what the symptoms that I was physically feeling, probably increased like 85 to 90% over, the first 3-4 weeks of doing the AIP diet. And, now I'm actually trying to do more ancestral than just the AIP diet itself, but that involves, factors like improving my sleep, which was probably the second largest thing I could have done, or maybe even the first, depending on, how bad your sleep is. But my sleep has gone from me staying up till 2 a.m. and, sleeping in till noon to now I go to bed at the same time every single night, which is 11 p.m. I wake up at 8:30 I make sure that I'm getting, you know, at least 8 hours of sleep. I don't expose myself to any blue lights or anything that's going to suppress melatonin in my body. Before I go to bed, I have like a wind down hour, and addressing sleep and diet for me have made such a huge difference. And obviously there's the disease process, which has already, you know, taken place. Like there's fibrosis within the glands. So you do have to have traditional medical intervention. And it's just really nice to be able to key all that together, especially with Dr. Perriman being so understanding and a very progressive doc, like I mentioned before, to be able to take all those things and acknowledge them and acknowledge each of those facets have their place in the treatment plan. And yeah, I mean,
Super.
definitely lifestyle factors.
Do you have a routine for your eyes, for what you do for the eyes themselves, like at home?
Yeah, absolutely. So got some you know, Doc P noticed I had a lot of allergy stuff going on. That's why I was kind of jumping up and down when I heard Meredith talking about that, because I'm like, that's exactly what I had going on too. So she has, you know, an allergy drop, and then after the allergy drop, I use Xiidra, which has like an anti-inflammatory pathway that isn't really related to steroids, right? Because I know I was a steroid responder, so we found that my pressure was increasing when I was using steroids. So we use them sparingly, and I don't really have to use them very much nowadays. It's very rare that I get a flare up. But yeah, it's just the Xiidra and the allergy drop prior to the Xiidra, and just keep my lids clean. You know, I clean them in the morning, and I shower, you know, every day. I hope that most people, you know, try to clean their eyes when they're in the shower too, but just using things that aren't necessarily harmful or irritating to the eyes either. That's a huge part. I switched to like natural soaps and lotions and things like that. So
Super.
my routine is very, very simple. I don't have to do much nowadays. And when I do have a flare, which like I said is very uncommon, I do a warm compress, you know, and that's maybe once every 3 to 4 weeks. If I've had, you know, multiple assignments due in the same day and I'm stressing out, it's really school. You want something that flares your dry eye, you know, get into a couple college classes.
Super. Well, thank you. We have our results back from the second poll, and it looks like the majority of the audience out here only, let's see, we got 14% have some kind of gluten intolerance. So 66% no, 20% approximately don't know either way. So that's interesting. We're going to introduce poll number 3 now, and then we're going to open it up for some Q&A because we're already halfway through the show, if you can believe that or not. So our third question goes back to something that Andrew mentioned, and their third poll is, how many hours of uninterrupted sleep do you get on average each night? And is it 5 hours or less? 6, 7 hours, 8 hours plus? I wish. That would be great. So let's, someday I'll do that. But now these polls, these next 2 polls, they're going to be a little bit faster. You only have about maybe 7 or 8 minutes to answer the audience. So we're going to open it up to some Q&A, and let's see what we got here. I have to put my glasses on. And this is just my iPad, because where the questions are coming from, so I'm not ignoring you, everybody. Where you say, interesting, we have 2 questions already about drops. What about CBD drops for MGD? And other is looking for inexpensive alternative to eye drops, saline or water. So let's take the first one, CBD. And Dr. Perriman, you want to answer that one?
Sure, since it's legal in Washington, I might as well. So CBD in a inhaled form, the vapors actually contribute to meibomian gland dysfunction. We know that the particulate matter from cigarette smoke and from marijuana leaf. The isolates, the CBD isolates, are CBD as one of the isolates of the cannabinoid family is very irritating to the eye. I've not come across a formula that's comfortable. CBD is soluble in oil only, and like I said, I've not seen a comfortable version of it. However, there is some peer-reviewed literature talking about the role of the cannabinoids, which includes THC and CBD, and their role in as anti-inflammatories. So for that situation, or for chronic pain, we'll often suggest lozenges, because again, I don't want people smoking it and having the vapors make their dry eye worse. But lozenges, oils, tinctures that go under the tongue get absorbed very quickly, and you get a body-wide effect. Because remember, dry is not just this. It's the whole, all of it goes together. It's not just the eyes.
Excellent.
So, yeah.
Great, thank you. And then Dr. Brimer, do you want to take on the other one? Do you have an alternative eye drop? Saline, water?
Not water. Don't ever use water. There's too many microorganisms in there, so you could do more harm than good for sure. But I am a fan of just buffered sterile saline eye wash. So especially, we've talked about allergies a lot tonight. These are the folks that I see a ton of debris in their tear film. And sometimes when they take a nice thick tear and they add to it, it's just solidifying it all and trapping that debris in there. So instead, I like them to get a bottle with a nice fine point on the end, pull the lid down and really stream it for 3, 4, 5 seconds and have it flood down. And patients tell me that it feels so good, and a lot of times better than just, expensive tears.
Super. Okay, and then we have another question, which was we've got a lot of the doctor questions, but also some for the patients too. There's one. It was with my doctor has me doing compresses every day. I have chronic MGD. Why do some dry eye patients need to do compresses and others not necessarily daily? Does anybody want to take that one on? Dr. Brimer, since you're up.
Sure. I think that warm compresses every day would benefit all MGD patients, but as far as how necessary it is, it depends on what's coming out of the glands and what stage they're in at this point. So a lot of times at the beginning of therapy, the meibum, the oil they're creating is very thick. I say it's like Crisco instead of olive oil. And so if they're like that and a lot of their glands are clogged up, we may even have to do something in the office to evacuate them, but definitely they're going to need a good intense warm compress mask like yours, Suzanne, where the heat's going to penetrate better and it's going to stay hot for 15, 20 minutes, not a wash rag. But later on, when we get further in our journey and they're really stable and they're doing great, then we can back off on some of that because we're at the maintenance stage now.
Super. Okay, and then we have another question about wanting to know, this one is for Meredith, just your daily routine, like how you some people wanted, I'm going to share with the audience if you don't know, because you work full time, right?
Do. Mm-hmm.
You work full time, and sometimes you can get overwhelmed when you have extra steps that you need to do. What is your routine when you get home relative to do you do compresses, all that stuff? And you said that you were non-compliant. Did you find certain things all of a sudden that you just needed time for them to work before that it was like worth it? You just needed to invest some time in new routines?
Finding the time is a big deal for me, but also I rush a lot. So I work human resources, so I stare at a computer all day. And so when I get to work, I spend 8, 10, 12 hours sometimes staring at a computer screen. So in the morning when I wake up, I wash my face and I use the tea tree oil to wash my eyes or my eyelids. That has helped tremendously. Like I probably think that was the first thing that I really noticed a big difference. when I started that. I would line up everything on my counter to try to remember, and the tea tree oil helped a lot. And then after wash my face, I use my allergy eye drops in the morning. And let's see, I am supposed to be taking my fish oil supplements. That is part of what I have not been as compliant on, but I'm getting there with that. So I'll take those in the morning. And then when I go to work, I have to be very careful of my surroundings at work. I love my space heater under my desk, and that does not help at all. So I have to monitor the use of that, and I have to when I had to rearrange my office to stay away from the air vents in the ceilings so that it wasn't blowing directly on my face. And remember to blink. That was a big one. I would find myself staring at the computer, and I got blue light filter on my lenses, my glasses, and I was not wearing contacts at work, and I don't think I could wear them at work now either. But, and then just getting home and doing the warm compresses if I needed them in the evening, and washing again with the tea tree oil at night.
Super. Thank you. And we have another question. I'm going to hand this off to you, Dr. Perriman. So the audience says, wow, are styes related to dry eye? I used to get styes. And I think we've seen more styes with COVID, right? With mask wearing. Have you seen that? Is that true? Because maybe we can share a little bit of that knowledge out there and why.
Yes. So several aspects to that question. Are styes associated with dry eye? And the answer is yes. To me, a first time chalazion or stye is dry eye until proven otherwise. There's something wrong with the oil glands, and the oil glands are critical for protecting the other components of your tears from evaporating. So yes, they are linked. Like you can have one and be okay, like just a random stye, like maybe you were mucking out the barn or something, or moving households, something like this. That can create a stye. But certainly if they keep coming, or if they're associated with any other symptoms, go get checked out for dry eye, because if we catch this early, we can help prevent the oil glands from atrophying and getting worse over time. The other part of that question was about masks. So masks are super important, right? We need to wear our masks, but the air can escape from underneath and circulate around your eyes, contributing to your tear film instability, your tear film breakup time. And we are seeing a significant uptick in chalazia and stye associated with masks. And we think part of it might be the oral flora that's also getting up around the normal ocular flora and disrupting that bacterial neighborhood to the point where there's a rumble and there's inflammation and there's another stye, so another chalazion. So yes, we do think masks. It's called MAID, mask-associated dry eye.
I'll be darned. And the one thing you just brought up that I think is important for the audience to know, and maybe Dr. Brimer, your thoughts on this as well, and then I have a question for you, Andrew. Is that with meibomian glands, we've used in the industry, we've talked a lot about the dental model and using that as an analogy of, making sure that you're doing what you need to do at home and seeing your eye doctor. And the big difference I always think of, like with the glands, when you're talking about those meibomian glands, there's no implants, correct? Like when what you have is what you're born with, and then when you lose them, there's no way to get them back. Is that correct?
Yes. One thing that I like to do is image everybody yearly and monitor those glands to see where we are, because it's kind of like if we related it to glaucoma, if the nerve is stable and all our data is consistent, then we know that the treatment we're doing is enough. And in dry eye, we judge it by symptoms a lot of times, but as far as presentation, I want to see it to that level of detail and know that the glands are not degrading, because once they do, we can't get it back. So I describe it like a one-way street. If the oil can't go out, it can't go back in, and so the body stops producing it. It basically dries up. So we definitely want to keep that oil moving so that it doesn't get that signal to shut down.
Super. Thank you. That's a little anatomy lesson. And then Andrew,
Can
I think you had
Oh.
mentioned something about part of your treatment in office is IPL. Is that correct?
Yeah, totally.
I'd love to hear your experience, how it feels as a patient to have IPL, how you describe that, and then I'm going to ask the doctors what's going on, okay? So you can tell the audience how you feel when you go in and get IPL.
Absolutely. So really quick, let me just say one thing about the mask contributing to eye irritation is I found a solution. It's an old surgeon's trick. When you put the micropore surgeon's tape over that gap, it doesn't like tear your face off or anything. That works really well. It's made for that. So it keeps it out of your eyes, which is nice.
Great.
But my experience with IPL, I am fidgety and terrified of pain, and I was really worried about it. But it's honestly it's not that bad, and I have noticed immediate benefits after using IPL, and I know Doc P has a lot of research in that area going on right now. And I mean, anecdotally, for me, it works really well because, what's going on? There's a lot of inflammation. There's a lot of blood vessel proliferation. And, what better way to calm that down than to sort of reduce the amount of surface blood vessels. And like I said, it's immediate for me. Days after if I had a flare, which like I said is rare nowadays, if I go in for an IPL session, that's a thing of the past.
Great.
For the
Thank you,
next.
Andrew. That's wonderful. I have a question from
No problem.
Dr. Perriman regarding IPL, so it's on the same topic. And she says that my doctor uses them on the outside of the eye and takes them off. Address shields. Like, do you use shields? Should shields be used during IPL, and why?
Great question. You have to have eye protection. That's non-negotiable. Like, we have to protect those precious eyes. You can achieve that through large stickers that go over the top of the lids, or you can achieve it through a laser grade corneal shield that goes under the lids but protects the rest of the eye. So there's two different ways to do it: treating around the eye area or treating closer to the lid margin, avoiding the eyelashes by about 2 millimeters. But you have to put a corneal shield in place to protect the eye itself. So that is a treatment option. As far as which method is better, I mean, it definitely takes longer to put in the shields and to deal with all that. So it definitely adds time onto the procedure, and we think our results are better than some of the peer-reviewed literature because of taking the time to treat on the lids as well.
Interesting.
You rob banks because that's where the money is. Put IPL where the inflammation is, right?
Thank you, Dr. Perriman. And we have a lot of people asking what it is. So a lot of patients, they don't even know why IPL and how it works. Do you mind sharing that?
Oh, I would love to. IPL stands for intense pulsed light, and it's intense. It's not a laser. It's a broad beam light, and it has there's 5 different mechanisms by which it works. And when we're talking about meibomian gland dysfunction, there's 6 interrelated mechanisms, and I call them the beasto, rawr. The beasto of meibomian gland dysfunction. There's the bacterial and the bugs, the abnormal flora and the demodex. There's altered enzymatic conversion. That's that lard-like quality instead of that olive oil-like quality. Inflammation. There's inflammatory cells surrounding the meibomian glands, secreting these cytokines that go across the meibomian gland membrane and make the stem cells sick. They can't function as well. There's stasis and sludging. That's the S. The T is altered melting temperature. That's why we keep telling you, use the warm compresses. And finally, there's the O, obstruction. And IPL is 5 out of the 6 heads of the beasto. The one thing it doesn't do is lasting thermal increase in managing meibomian gland dysfunction. That's why we ask you to layer on home heat therapy modalities, and then the quality of that meibum corrects over time as you control the other 5 heads of the beasto. So it's just it's a six-headed monster. We got to slay them all.
Excellent. And then Dr. Brimer, I have another question here that somebody had asked, isn't krill oil better than fish oil? Do you want to take that one on?
In my experience, no. We've got a lot of more peer-reviewed data on fish oil, but specifically the EPA and DHA. So same thing as if you're thinking about it in foods, because that's the absolute best way to get it. We just can't seem to get enough of it. But you can get omega-3s with walnuts and avocados, olive oils, things like that, but that's more ALA, and we want the kind that comes from the fish, the EPA and DHA, because that converts the correct way to really achieve our goals of thinning out that myelin. And in addition, there's other additive supplements in addition to the omega-3, like omega-6, where you're working with two different mechanisms of action to reduce inflammation. But I found those two to be more effective than krill oil. Would you agree, Dr. Pearman?
100%. Yeah, and I'm the same as you. I believe in the combination of the EPA, the DHA, and the right amount of GLA. That's where the magic is. Okay,
great. And then we have, with Meredith, another question for you. Do you, well, actually, I'm going to just give some poll results because I'm going to put the last poll up. So for sleep, our question was for sleep. 25%, almost 26%, get 5 hours or less. 51%, 6 to 7 hours, and 23%, good for you, they get over 8 hours. But that's something. It's almost 75% below what we believe probably is a necessity. And we can talk about the effects of sleep. I know, Dr. Brimer, this is a topic that you love to talk about. I just had a quick question for Meredith. Meredith, how many hours do you sleep a night?
Uninterrupted, probably, I would say 7 to 8, maybe.
7 to 8. Well, good for you. So
I try.
Yeah,
I aim for it.
And that's probably because, Dr. Brimer, maybe you can chime in, like why sleep is so important in the dry eye cascade, the other treatments, like is it stress release? What is it about sleep that's so important?
I think it's multiple layers, but we could probably sum it up in one sentence of saying dry eye can't exist in a closed eye environment. And so for one thing, if you miss out on some of this closed eye time, it means more exposure. The eyes are open more. But maybe more importantly, I don't know, equally as important, when you lack sleep, it drives more inflammation in your body. And a lot of times, you're lacking sleep because of anxiety and stress. And so these are coupled, but, sleep is the way that your body recovers. When I go for a period without sleep and not taking care of myself, I have more gray hair. But it's directly related because I don't have my recovery time. So I think there's probably countless ways that sleep impacts it. I can tell a big difference among patients in their success and their outcomes when this is a major default in their system. So I can definitely speak to the impact. I don't know that we'll ever know all the ways that it truly works mechanically, though.
Okay, super. Well, Andrew, I know you've had really great experience with it. We do have another question, and this one, there are 3 prescription drugs out there for dry eye that are available, and there's questions about what the differences are. Like, are they kind of doing the same thing? Are they doing different things? Dr. Pearman, do you want to take that one on? Like, how do you know?
Sure. I'd love to. So the 3 immunomodulators, we call them. So there's several in the steroid class, and including a new one that's FDA approved for dry eye flare-ups. So we're all kind of excited about that. Hopefully that'll help with insurance coverage and all those sorts of issues. But the 3 meds you're talking about are Restasis, Xiidra, and Cequa. Now, Restasis has been around for about 17, 18 years. It's a trusted, tried and true friend. Xiidra is the middle child, and that one came out in 16 or 17. And the last one is Cequa, and that's the new kid on the block, and that is another form of cyclosporin. They're all different formulas. So it's very different. So the base molecule is cyclosporin in Restasis and Sequa. And that is a molecule that's found in nature. It's has these broad spectrum anti-inflammatory immunomodulatory powers. It also has the ability to help defeat those activated T cells that are creating all that inflammation while protecting your goblet cells, your corneal cells, your nerves, all that other stuff. So I call it the sword of truth, right? Slay the bad guys and protect the good guys. And then you've got lifitegrast or Xiidra, which is super interesting because it's one of the only two other things I can think of that help to address the immunologic bridge between allergic conjunctivitis and meibomian gland dysfunction. You can only address it with steroid and with Xiidra. And so for my heavily allergic patients, chronic allergies, seasonal allergies, whatever it is, I have a preference towards Xiidra because I know I can help break that immunologic bridge from the allergy to the meibomian gland dysfunction, in addition to using a quality anti-allergy eye drop as well. No pills, no anti-allergy pills. Those decrease your natural defense against allergies, which is increased tear production. The oral ones decrease your lacrimal gland output. And so you end up handcuffing your natural defense mechanism. So those are the three meds.
But I failed to bring out the fourth poll, so it's actually perfect timing because the fourth poll is about allergies. So let's bring up the fourth poll. You're going to get like 3 minutes to answer this. Do you have any known allergies? If yes, what kind? Seasonal, food-related, medication, more than one above, and none. So back to while the audience is answering that one, Dr. Pearman, that was a really good. So it sounds like where there's a lot, there's a lot of advertising about prescription drugs, but basically it goes back to go see your eye doctor, be properly diagnosed because it's not the same suit for everybody. So they all have their lane. They all do great things for the patient that needs them. And basically it's not one size fits all. Is that about right?
That's correct. That's correct. And when your doctor does prescribe something, you have to be patient with the medication. It can take a while for things to start feeling better. And people forget pain. Otherwise you would never give birth more than one time. It's a natural mechanism, right? So you forget how bad you used to feel. The medications do work in supporting the ultrastructural parts of the entire lacrimal functional unit. The corneal nerves under cyclosporin get normal at 6 months. Like really cool things happen, even though patient may say, well, I don't feel any better. It's like, but I'm getting a benefit in these other ways. And the two medicines work together. Cyclosporin and lifitegrast can be used together if you can get around some of the insurance shenaniganery. Not a fan of insurance companies, but anyway.
Okay, thank you. All right, we have another question. Dr. Brimer, I'll point this one to you, and maybe Meredith, you can chime in too. It's from somebody in the audience wanted to find out about how you were diagnosed with Sjogren's, and that you had early markers, and what was that Meredith, maybe you remember what that was or how it was explained. But Dr. Brimer, in general, what is that process for diagnosing Sjogren's right now? Let's start with Dr. Brimer, so we're not talking specifically about Meredith, and we'll go back to Aaron.
Okay. Historically, we would do a blood test, and it would be two markers, anti-SSA and anti-SSB. The problem with that is that patients can test negative for too long before it's finally discovered. So they did come out with a panel, and it's called the SHO test, and it has early markers. These are much more sensitive. Personally, the struggle I have with them is that when a patient tests positive just for the early markers, if I send them to a rheumatologist, they don't always acknowledge it, especially when the majority of their patients are kind of crawling in with all these horrible systemic symptoms, and then this patient walks in with dry eye and an early marker test. They don't always get the attention that they deserve. So sometimes I'll wait and I'll repeat it again, but it also depends on what other systemic symptoms there are. Is there joint pain? Is there fatigue? Are there other things going on? With Sjogren's specifically, we're looking for dry mouth, dry eyes, because it affects the salivary glands and the lacrimal glands initially, but it can certainly go on to affect much more systemically.
Okay, perfect. All right. And then with you, Miss Meredith, had you ever heard of Sjogren's when you heard that you had early markers?
I had heard of it before. I had heard that it's generally a rider with a lot of other a lot of other inflammatory diseases, specifically rheumatoid. And rheumatoid runs in my family, and so I had heard that word plenty of times before. So I had a lot of blood work done. My rheumatologist ran, I think there was like 3 or 4 pages of different blood tests that he ran just to cover all of our bases. And the Sjogren's markers all came back positive. So,
we're going to be, we only have a couple minutes left here, about 4 minutes left. And with Meredith and with Andrew, I think one of the things that you guys have both had different experiences, but if you could, kind of, Meredith, start with you, a pearl that you want to share, because you had a whole bunch of stuff that you were crying in the office. I would do the same thing, and I have done that because it's a lot. It's overwhelming. So what would be your words of wisdom to the audience if they're in your shoes and maybe they have not been diagnosed and they're listening in and they haven't experienced similar years? What would your advice be?
Definitely don't be afraid to receive bad news, because the bad news means there's a solution. So, and if you can get there, if you have the patience, you can get to your solution. So bad news is not always a bad thing, ultimately. So.
That's great. That's great advice. Super. And
So
Andrew,
healthy.
what about yourself, Andrew? What's your advice?
Yeah, so not everybody can find great docs like Dr. Brimer and Dr. Pearman. Not everybody has access, to a doctor that's in their area that's going to acknowledge dry eye disease or acknowledge the multifaceted approach treatment plan that's necessary to really take control. So I would say be your own advocate and really search hard to try to find somebody that is going to put you in the right place. Don't just, if a doctor turns you away or says, oh, you're fine, and just recommends, you take doxycycline and that's it, try to go to someone else. Keep searching.
Good for you. That's awesome. Those are some incredible pearls. And we have the results from poll number 4 with allergies. We have seasonal allergies make up 28%, 0 food related, 14% medications, 34% 1 or more, and 22% of the audience, 23, none. So go figure. So it's interesting. That goes to show you again, we've heard a lot. I know the doctors, Dr. Pearman and Dr. Brimer, have seen literally thousands of patients, all very unique, all very different. It goes back to, this is a very exciting time for doctors and for patients because you can feel better every day. It's just a matter of putting your mind to it, finding a dry eye doctor, working with them, partnering it, do what they ask you to do in office, whatever they can do it. They can fill a cavity, they can do a root canal, but at the end of the day, you're not going to stop brushing and flossing. So you do at home what you need to do and follow their advice, and you keep to a routine and you will feel better. So I'm really excited for tonight. It was a fabulous, I thank you all for being here. We're going to do another one on March 25th. Thursday, same time, 5 p.m. Pacific Standard Time, 8 p.m. Eastern Standard Time, and we're going to hopefully have all 4 of our panelists back, our dry eye experts, and we have a whole different format, a lot of fun coming. So thank you very much for tuning in, and I wish you all a very, very happy, wonderful evening. Thank you.
Thank you.
you.
Have a good night.
Bye.